You may have heard a lot of people talking about block granting healthcare recently.
Block granting Medicaid. Block grant it to the states.
Large block grants. Working on a block grant issue.
When Republicans talk about repealing the Affordable Care Act, they usually mean replacing it with block grants. But before we get to that, let's take a step back. What actually are block grants? Basically, they're a fixed amount of money that the federal government grants to a state for a specific purpose. There are block grants for education, transportation, housing, you name it. And they work differently across applications and industries. Sometimes they provide additional funding that states wouldn't otherwise have, like money to combat the opioid crisis. And sometimes they're policy reforms packaged as grants. This is where healthcare comes in, which the GOP has been trying to block grant for a long time.
The plan we're proposing will substantially reduce the need for 465 pages of law.
When you get rid of this and you say to the governors, you can in fact solve this problem.
The time for action is now.
Our approach is to end the onerous one-size-fits-all approach to Medicaid financing.
And lately, that strategy has taken the form of Obamacare replacement bills. And that means costs and regulations are largely left to the states to work out.
If you like Obamacare and you want to repair it, you can. If you want to replace it, you can.
Only it's not that simple. There are basic issues with block granting healthcare that are hard to ignore. Proponents argue that block granting would give states the flexibility to make the healthcare system work uniquely for them. But block granting proposals generally reduce federal funding from the get-go. And to make matters worse, grant proposals thus far give each state a set amount of money. So when healthcare costs inevitably continue to rise, the federal government won't give more money to the states to make up the difference. So remember when Senator Graham said,
If you like Obamacare and you want to repair it, you can.
When these grants don't keep up with healthcare needs, then states can either A, rework strapped budgets to try and keep Obamacare as is, or B, the more likely scenario, cut healthcare program costs, meaning some people will lose coverage. Which brings us to another GOP argument for block granting healthcare. Cash-strapped states will have an incentive to run a tight ship. After all, states will only have access to however much money they add to the pot. And states have to balance their budgets by law.
You'll have a race for efficiency rather than just a race to write bigger and bigger checks.
But see, not all states are treated fairly. For example, in a recent attempt known as the Graham-Cassidy bill, the distribution of funds would disadvantage states that, under the Affordable Care Act, expanded Medicaid and enrolled more people in the marketplace.
My goal is to make sure that if you live in South Carolina, you get the same amount of money from the federal government as you would if you lived in California.
But because the bill in the short term uses funding for the Medicaid expansion to pay for block grants, states like California, New York, and Massachusetts would struggle, even more than states who didn't expand Medicaid.
It assumes that the cost of health care across the country should be the same everywhere.
So sure, block granting could seem like a good idea. I mean, who doesn't want more flexibility and incentives to run more efficient programs? But in reality, the money just doesn't add up. So after more than 3 decades of debating this strategy, isn't it time we give it a rest?